What's up, you guys? My name's Miguel, fellow Xray Tech here, giving you your daily dose of radiation. In today's video, we are covering what it's like in a day of life of an Xray Tech. So to give you context, I am a night shift Xray Tech, and I've been doing it for about 4 years. The night shift world is a little bit different versus the daytime people, given the fact I work ungodly amount of overtime in both teams, days and nights. But right now I've been on a current nighttime streak where I've been pulling like 25, 26 nights straight. So depending on how you're built and the way you operate, and if you have kids or if you don't, your life can kind of vary. So if you're like me and you're an average Joe who has kids, and so if you're stuck with the nighttime shift, right now I'm heading into my first night. So can be like the best example of what it can be. So yesterday was the weekend. I went to sleep like my normal daytime person would go to sleep. I woke up, drop off the kids, and then here I am going off to the gym, doing whatever I have to do till probably around 12 midday. And then I'll probably go to sleep, and I'll sleep until probably 4, maybe 5, depending on how I feel. But I usually don't, I'm not a regular person who likes nighttime. That's what I was stuck with. I enjoy it, like working it, I do, but I'm just not like in a regular day-to-day. If I'm not working, I'm not up at late at night. I'm a regular, like 10 o'clock, 8 o'clock, I'll be asleep, So about 4 or 5, I'll wake up, deal whatever I have to do with the kids and stuff like that. And then my shift begins at 8 o'clock, 8 p.m. is when it begins. So usually that first night heading in, I don't get too much sleep because my body's already rested from the night before. There's other people who will wake up, do something, and then go back to sleep even sooner, and they can sleep through the whole day and wake up at the night, which is ideal if you don't have anything, because then you're more well rested. But someone like me with kids and responsibilities, I maybe average 4 hours today of daytime sleep, and then I'll head in and go into work. And then when I come off of work, depending how that night went, sometimes I'll go straight to the gym, knock that out, and deal with any life responsibilities, kids or whatever got going on. And then I'll kind of crash again, probably 11, 12, and then run it again. Usually 4 or 5 hours is kind of where I'm at. Some people, because they don't have responsibilities or don't have other stuff going on, maybe they can average more. That's kind of where I'm at. And then depending on on the weekends, because my lady who's a nurse can watch the kids, I maybe get to sleep in and catch up on some sleep. Usually I work a 7 on 7 off split, which would be pretty ideal for most people, because those 7 nights are pretty rough for some people. I mean, the other tech who just works 7 off, you can tell by night 7 your body does seem to kind of crash. Or it's just because you work it so much and your body already kind of knows that, okay, today's night 7, tomorrow is your Friday or whatever off. And I notice, even right now it's different with my body, but when I used to just not work overtime, it would come Wednesday, because we start usually Wednesday, run it till Wednesday. Usually I would wake up Wednesday morning and my body would automatically already be in kind of slump mode, because it's already kind of preparing, because I would run the schedule so often that my body already knew it's Wednesday. Even when we were going off, when it was Tuesday going into Wednesday night, my body already knew that today was Friday, we're gonna rest, and my body would already slept. Right now it's different because I work so much overtime, my body can't catch on to a regular. I'll run it 26 nights, and then finally one day it just crashed. I've noticed if you work enough of hours of overtime, especially at night, your body will naturally at that 7 mark want to crash and be like cut. But if you push past that, it kind of levels out. Like night 7 will come and you'll like crash, and then you kind of with energy drinks or whatever you got going on, and then it'll just kind of be in a steady state. Like I don't really get as tired running. Like once I get into the routine past like night 15, night 20, now by like the end of my 26, whatever I got, like it's not even a physically tired, it's more of just a mental kind of like you almost kind of want a little bit of a break. Like it's not even hard, it's just you do the same thing over and over. Eventually your body kind of needs a mental break. So occasionally I'll like split in like one Wednesday off in the middle of it, and that kind of helps me run a little bit more better. But that's kind of how it goes for my split. I mean, for the most part at work, it's the same thing. I mean, this is trauma 3 ER, mainly do x-rays. Occasionally we'll do some like squirt in some gastrographin to check some tubes, or I mean, you got the morning port responsibility, you have any add-ons that come in from the floor. Once again, the ER is the priority as always. And then certain floors will kind of vary on their priority, like rapid response or ICU or surgical ICU. But for the most part, we just chill in the emergency room and then whatever comes in. And then it really kind of depends. At nighttime, it all kind of depends on who's the doctor. Depending on who's the doctor, your workflow will kind of vary. Certain doctors are more X-ray tech heavy ordering. Other doctors are more CAT scan based. You'll kind of see with time at wherever establishment you're working at. And then certain doctors they'll run more labs and more other testing before they'll actually go with the X-ray. And the X-ray will be kind of towards the end, which technically speaking, that's kind of how it's supposed to go always. But now they've kind of gotten to the point where they'll order everything and just to see which one sticks on the patient, like to get the quickest result, to get them discharged. You'll kind of see that. Because certain things, like if they order it for a lab and then the chest X-ray, if the lab told them that they have X and Y disease, whatever they have, and then we just do a chest X-ray just to confirm the same thing, then they just got radiation when they didn't have to, if they already knew what it was. Now obviously certain patients, like with the X-ray, they can find out extra stuff with them, so I do understand, but it's a pretty good gig. I enjoy it. I mean, there's other people who enjoy working daytime. I don't, because I feel like if you run at 12 hours during the daytime, if you're willing to give up sleep, you can do so much during the night shift. Like as far as when you're off, because everything's open, appointments, everything will vary, but you do pay a little bit of a price. Now, obviously, you can run a few nights without that many hours of sleep and you'll be fine, but somewhere down the line of your like 7 off, you'll feel it. I can say that for sure. I mean, there's been times I've ran like good 7-8 days just off of like 2 to 3 hours of sleep, sometimes even a little bit less, because I just had so much stuff going on with the kids and whatever stuff like that. So it is possible. It's not gonna be the easiest on you. But if you're still here, I appreciate you. You can check out my channel. I will literally post every single day of the beautiful floor of radiology, X-ray, do some nursing collab videos since my lady is a nurse. I just acquire information from her if you're curious from that aspect. But yeah, I mean, there's some stuff you learn in school, there's some stuff you learn on jobs, and there's some stuff that until it happens at your work, then it's like you learn then. There's certain stuff that happens at nighttime that daytime people don't experience, like all the systems being down and certain programs having to be pushed manually, or how to deal with downtime. There's a bunch of stuff that only if you work at nighttime you'll experience. That's why you get paid the more money. Now, if you're curious about shift diff, certain places pay different amount of money. Mine, I mean, if you work daytime, prime daytime is no, it's just regular pay. And then if you work into the afternoon, it's like a $2, and then night shift is a $3. So we make the most amount of money. So if you're curious, like as far as how big of a difference, let's just say if I ran the same amount of days during daytime and then nighttime, and then I looked at the check at the very end of the day, I would probably have to pick up 2 extra daytime shifts to be able to make the money I make at night. I mean, even my lady, like I told her that, and then she's like, well, I don't want you working more. Like, I'm like, I couldn't afford to pay your bills off of the regular amount. Like, so there's that. I can't exactly say the amount of money I make because, you know, you get in trouble and all that stuff, but that's just kind of an example of if you think nighttime is worth it or not. Now, obviously, if you're gonna work nighttime, always try to negotiate your pay even more, because the hardest role to fill always at any establishment is the nighttime shift, because most people don't like working. At my hospital, prior to me, like the other shift that works with me, it took them like 8 months just to fulfill that position. And then right now, the opposite shift that I'm working for right now, that's why I have this ungodly amount of overtime. We're pushing, once again, like another 8 months, 9 months of they haven't found anyone that want to do it. So if you are wanting to do it and there's a slot, always negotiate your pay and negotiate your base pay. Your base pay is what is important to negotiate. Never accept their first offer, always run it back, because at the end of the day, HR always wants to hire you with the lowest amount of pay. So always try to negotiate your pay. That'd be my advice to you. And yeah, well, I'm about to go work out, and we'll see you on the next one.